According to the U.S. Department of Health and Human Services Administration of Children and Families, there are approximately 400,000 children in our foster care system across the United States. Furthermore, according to AdoptKids.org, approximately 20,000 children each year will age out of the foster care system once they turn 18 or 21, putting these children at increased risk for homelessness, increased unemployment, and poor education. Dr. Denise Fournier is a psychotherapist, coach, facilitator, and adjunct professor at Nova Southeastern University. She's also currently operating a private practice in Miami, Florida, known as Evergreen Therapy. Over the last 15 years, Dr. Fournier has supported and guided children in foster care, helping them get a positive leg up on their future. She's also active in the LGBTQ community. Thus, she joined me this week to have an important discussion on how we can better support our youth in the foster care and LGBTQ communities. I'm Kevin McShann. Let's have this conversation. With hundreds of thousands of kids left without a home across the country, Dr. Fournier and I began our time together by parsing through the options available to these deserving children in order to support them during their time of need, to give them every chance to succeed.
Good question. So the thing that's really important to remember is that kids enter the foster care system because they experience abuse or neglect in their homes, in their primary homes. And so when we think about how we can support foster children, it's really important to think as broadly and systemically as possible and think about where these kids start out in their homes, right? And so to support these kids, we want to support their families. And we want to take, it's really easy to kind of demonize these families because there's abuse going on in these homes and to kind of other or distance ourselves from these families. But rather, we should sort of turn toward the issue and say, what's going on in these households that's leading to these children ending up in the foster care system? What are the ways that we can support these families so that these children aren't separated from their families, so that these parents are capable of raising these children in a healthy way? And so one thing that we can all do is we can vote. And we can vote in elected leaders who are addressing issues of systemic racism, for example, because Black children are disproportionately represented in the foster care system, right? So we can look at issues like systemic racism in our communities. We can look at issues like livable wages for folks, right? Because stress and the pressure of needing to provide, the pressure that comes with poverty, that comes with systemic racism, all of these things contribute to what's happening in these homes. And so when we also consider the fact that about half of foster care children roughly will be reunited eventually with their families, right, after being in foster care for, variable periods of time, then it really becomes even more important to support the families that they're going to be reunited with, right? And so the way that all of us can really support these children is ultimately by voting, right? Unless we are going to ourselves find ways to become foster parents or to directly support those who are fostering these children, then we can look at, okay, how can we broadly support the environment, the context in which these children are operating, and voting and being mindful of those issues is one really important and direct way that we can do that.
Fournier is also a strong proponent of increased investment in our mental health resources in all levels of government in order to support children without a home.
In previous employment and previous experiences that I had working directly with the foster care system, so I used to work with youth who were preparing to age out of the foster care system. And one thing I recognize, one thing that is abundantly clear, is that there's inadequate support for these agencies. Our mental health care systems are really strained, at least here in the state of Florida where I live. These systems are really strained. So caseworkers are overextended. And so some of these kids and their needs are slipping through the cracks. And often a major issue is that there are few families fostering these children, and often these families are fostering many children. And sometimes because of the stress on the mental health care system, screening of these families might be insufficient and inadequate. So we may be placing children in foster homes that are not prepared to really support and meet the children's needs. So there may be education that's lacking in these houses. There may be support services that are lacking for these foster parents. And so the kids' needs are not necessarily being met in the household, and their needs may also not necessarily be met in the foster care system or in the mental health care system where they are being served, where the services are being provided for them. There are inadequacies, there are major gaps in these systems. And so these kids tend to fall through the cracks. And it may be that this is happening, at least in my experience, it was the case that this was also happening in the school system, where the needs of these foster children in terms of their mental health, in terms of their physical health, in terms of their education, were not being addressed because these kids were simply slipping under the radar for the fact that, of course, their teachers and school administrators are also overworked, overstressed, and not necessarily trained in order to identify the needs of their students who might be in foster care.
Now, we also know that approximately 20,000 kids each year will age out of the foster care system without getting the adequate family support. So you talked earlier about mental health. So I'm just wondering, how do we bridge the gap to support the kids that aren't unfortunately able to find a permanent foster care situation?
Well, I mean, that comes down to, again, thinking about what are the systems that these kids are going to be embedded in, right? So one might be the school system. And so one way is for there to be training for teachers, for school administrators to be identifying what the challenges are for children in foster care related to their mental health and how this translates into their ability to keep up in school, and how not doing so can sort of exacerbate and compound some of these issues. You know, when there's awareness and education, then there's a much greater likelihood that there will be intervention at the school level so that these needs can be identified and these kids who have these needs can be identified and they can be supported in that system. You know, and also in the foster care system, you know, if there isn't a permanent placement situation, then there is a great deal of support that's needed in these systems so that children can at least be, fostered in an environment that is supportive to their well-being. And so we can make sure that our foster care systems are well-funded. We can be volunteering, we can be mentoring youth who are in the foster care system through programs like Big Brothers and Big Sisters, for example, where we can make direct contact with these youth and make a direct impact on their lives. And once there is a supportive environment for a youth who is still in the foster care system, then we're helping to create a solid bridge so that these children can become capable and self-sufficient and live, stable, independent lives once they transition out of the system.
And just before we move on, I'm also curious to know, If anyone is interested in getting involved in the foster care system as a foster care parent who just wants to support foster children in general, what are some of pieces of advice that you may give to them as they embark on this process?
That's a really good question. I think, one of the things that's really important is to take an honest sort of inventory of your readiness to take on this responsibility, right? I mean, there are so many kids in need of good homes, and there are so many good-hearted people who want to provide those homes. But some of those people might be intimidated and might not be they might think that the process of becoming a foster parent is too overwhelming or too difficult and rigorous, when in fact, it really is a very straightforward process, and there is a great likelihood that capable families will be approved of as foster families. So first of all, don't be intimidated, right? Find out the information that you need to equip yourself with in order to become a foster parent, should you feel called to do that. And if you do feel inclined to become a foster parent or become a foster family, just be aware of the resources that you have available to provide a good home for these kids, and not just material resources, but also time, energy, attention. Often these kids do have complex needs because of the abuse and neglect that they experience. And so it's really important for families to have awareness of what it means to have a child with mental health needs, with perhaps developmental delays resulting from the abuse and neglect. Maybe there are cultural differences, right? And so you want to be culturally competent as well. And so there are a lot of layers of sort of awareness, education, and readiness that are really important to consider. So anybody who's open, should be totally encouraged, and should also be challenging themselves to prepare the most, supportive environment possible for these kids in their homes.
And I know that in addition to your experience working with foster care families and children, you also support people with other mental health issues as well. So I'm just wondering more broadly, what do you think is 2 or 3 major mental health issues that have to get addressed that have either been underfunded or underaddressed?
I mean, I think across the spectrum, I think there is still a great deal of need for more awareness around mental illness in general, particularly complex issues like PTSD, even like depression, or like unidentified severe mental illness. These are areas of opportunity as far as education is concerned. Also, one area that really needs more understanding is the area of people of color and people of culture, to borrow the term from Resma Menachem, who's a race-based and trauma-based psychotherapist, is that, in these communities, there might not be as much education, there might not be as much acceptance because, these families are coming from a different cultural context. There might be a lack of understanding about what mental illness is, and how to treat it, and how to support people with mental illness. And so in these communities especially, it's important to identify the needs of people with mental illnesses, so that the appropriate services can be provided, and so that these people have an opportunity to thrive.
And we recently saw that the Supreme Court upheld the rights of the LGBTQ community when it comes to employment and voting. So I also know that you do a lot of work with that community. So I'm curious to get your thoughts on what needs to be done to support that demographic as well.
So there are 2 kind of levels at which we can think about what needs to be done for people who identify as LGBTQ. One level is the personal, and the other level is the political. And these are distinct, sort of categories, if you will, but also very much interrelated. So we have made a great deal of progress, but we have a long ways to go in terms of equity and equality for LGBTQ people. At least, I can speak for the United States. We have made a lot of legal advancements, but there are still many, many, many states in which there are no protections. My state, Florida included among those, so there are no protections for LGBTQ people against discrimination, right? And so there are a lot of gaps. Politically, there are a lot of gaps legally that need to be filled. So one way that we can all be lending a hand to close those gaps is by being very, very mindful when we vote. As we Americans have learned in the last 4 years, advancements can very quickly be reversed. And progress can very quickly be reversed. And so we need to continue to push, we need to continue to advocate for legal protections for LGBTQ people so that we can continue to advance those protections and advance that systemic equality. And then at the personal level, it's really about education and awareness. Promoting visibility, promoting understanding of what it means to have an LGBTQ identity. All of that stuff is going to transform us into more aware and affirmative individuals who then collectively make up an environment that becomes much safer, more supportive and nurturing for the LGBTQ community.
And what do you think is the most misunderstood dynamic about that community in general?
Oh, there are a few. There are a few. One thing that seems to still be misunderstood is that LGBTQ people are at higher risk of mental illness. They're at higher risk of substance abuse. They're at higher risk of suicide. There are a lot of complex issues that people who have an LGBTQ identity experience. And it's important to remember that those things are not, those things that these communities suffer from are not innate to them as individuals. These things happen because of the broader context in which LGBTQ people are living. And so they are at disproportionate risk of experiencing these mental health issues, of experiencing violence, and of experiencing suicide because we still do not have a wholly affirmative and safe context for LGBTQ people. And so this is not an indictment. When we hear about these things, it's not an indictment on these individuals, but rather an indictment on our culture and an indication of what's still needed in our culture and in our communities in order for these risks to be reduced for LGBTQ people. So that's a really important point of awareness, I think, that we need to do better on.
And you've talked extensively about being aware of who we vote for. So I'm wondering your thoughts also on the legislative action you would like to see taken to support either the LGBTQ community or the foster care community at large.
Oh, that's a good question. I think broadly speaking, as far as LGBTQ rights are concerned, I'd like to see, across, at least in my country, across all 50 states, protections, legal protections for LGBTQ people against discrimination so that they can maintain employment. Also legislation that allows for LGBTQ people to adopt children, right? So there are many, many couples that identify somewhere under the LGBTQ umbrella who can provide really supportive, really safe, really healthy homes for children in the foster care system, right? Permanent homes, forever homes, and who are very desirous of welcoming a child into their lives and are very prepared to do so. But in many states, they're not able to do so because of legislature that discriminates against them as couples. So these are, sort of intersections where legally we can improve the protections and really solidify these protections so that not only can LGBTQ people have access to the same rights and, know that they can work freely and live freely and marry freely without discrimination or without legal barriers, but also so that these foster kids can find themselves in good, solid placements.
And I'm wondering, what would be your message to anyone that wants to get involved in supporting the LGBTQ community specifically?
Do it. That would be my biggest one. Because so often we have these ideals and we have these ambitions and we think, oh, I'm a good person. I support LGBTQ people in my heart, right? And that's a beautiful thing. But it's really important to translate that into action. And in every state and every city, there are organized groups that are working really hard to get the right people in office to advance the rights of LGBTQ people, to create, parity and equity for LGBTQ people. And they are always in need of volunteers. And realize that any impact that you make, even if you are phone banking, for a local politician who's going to promote and advance certain legal protections, even if it seems like grunt work, even if you're, having people fill out forms at a pride parade, or, providing education for your communities, no matter how small the act might seem, it's still a contribution. And if we're all thinking about how we can translate our good intentions into actions, and really understand that those actions, though they might seem small, are truly significant and necessary, then I think more of us are going to get involved. So that would really be my biggest piece of advice for people who are interested, is think globally, act locally, right? And look in your communities, your direct local communities, to see how you can lend a hand.
And then my final two questions for you just have to do with what would be your final parting message to anyone watching this who may identify in the LGBTQ community and in a foster care situation. What would be your final message in terms of words of inspiration or affirmation? And then finally, can you just tell me about the good work that you do at Evergreen Therapies, and how people can get in contact with you if they're interested in connecting?
Sure. So my message to both LGBTQ people, especially youth, and to youth who might be in the foster care system is, stay encouraged and have hope. Have hope that the world is changing. Have hope that there are so many people in this world who are prepared to support you, who are prepared to make the world safe for you. And those people are mobilizing and increasingly so to make this place better. And there are so many people out there as well who have aged out of the foster care system, who have themselves, experienced the difficulties that come with claiming an LGBTQ identity, who can tell you, as the campaign goes, that it does in fact get better. That on the other side of these difficulties of navigating the foster care system and going through the challenges that come with that, on the other side of the difficulties that come with coming out and finding your place in this world as an LGBTQ identified person, there is a light, and there is a full life, and that is available to you, and that is there for you. Reach out to the people that will help you to sustain that courage and that hope while you're on your way to that brighter place, to that place where it gets better, and just know that it's there waiting for you. And as for my practice, Evergreen Therapy, it's located here in Miami. I am working virtually at the moment because of course, the COVID-19 pandemic. But I've been in practice here in Miami for about 5 years. I work with a broad variety of individuals as well as couples and even families in my practice. And I am so happy to be able to be in private practice because not only do I get to work directly with folks who come to work with me as clients, but also can be an advocate for the mental health needs of my community. And I'm happy to, sort of be a shepherd for anybody who needs support hooking into mental health services, even if they're not going to be working with me. I am so honored by the ability to do that in my position as a private practitioner. Anybody who wants to get in touch with me, if I can support in any way, can contact me by email, denise@evergreen-therapy.com. You can also follow me on Instagram. My handle is @Dr. Denise Fournier, Dr.Denise Fournier. Those are the best ways to get in touch with me.
Fantastic, Doctor. I want to thank you for your participation in this wide-ranging discussion this morning. Thoroughly enjoyed the experience. Hopefully you did it as well, and I thoroughly enjoyed your insights and perspective. Thanks so much for being here.
Thank you so much, Kevin. Thanks for having me.